cancer, which would be appropriate. If you had uterine cancer, hysterectomy is appropriate. But for fibroids, it's just not necessary, and we're trying to change that dynamic,
Right.
that you don't have to have surgery if you don't want to. Our patients come into our center in the morning. The procedure takes me about 30 to 45 minutes. It's called UFE, uterine fibroid embolization. There's about a 4-hour recovery after the procedure in our center, and they go home with a Band-Aid. That's it. And their uterus. About a 5 or 6 day recovery. And it's transformational. It changes.
Wow.
You were talking in the last segment about women's periods and how heavy they are. The women that I see in my practice every single day here in Atlanta are bleeding horribly. It's not just that they're doing it every day, for 5 or 6, 7 days a month. They may do it for 2 weeks, and it's gushing and flooding, running down their legs, exploding, passing clots. I saw a woman last week passing fist-sized clots into a diaper 4 days a month. It's miserable. They have to know where every bathroom is. It takes over their life. Their menstrual takes over their life,
Right.
and it's horrible. And a lot of these women, not only are they mentally just drained from all of this, it's a physical drain. It's called anemia. They lose all this blood, and when they lose all this
I
blood,
see.
iron and hemoglobin go
Right,
with it.
exactly.
And so now they are anemic. They're tired. They're weak. They may get migraine-like headaches every month. They may chew or crave ice. Hair changes, nail change. I mean,
Wow.
it's miserable, and it's unnecessary. There's over 1 million women in this country suffering in silence. They don't want hysterectomy, and I don't blame them. I wouldn't either. But they don't know of any other option, and UFE is transformational. I've been doing this procedure for almost 25 years now in Atlanta. I did the first one in Georgia. I've been doing them ever since. But the information isn't getting out there, and people need to know they have another option. As I say, it works in almost everybody. It's outpatient, home the same day with a Band-Aid, and they get to keep their parts. Because I can tell you, I spoke at Tuskegee recently, and I met 2 women less than age 30 that had already had a hysterectomy.
Oh my God.
And it was tragic. They were crying. I was crying because I have daughters that age. You don't have to have hysterectomy. Your uterus has a lot of important functions. I'll hear all the time, well, my doctor told me that I didn't need my uterus anymore because I don't want to have kids, or I'm done having my kids. No, that's false. The uterus is not the appendix. It has a lot of other important functions. It's important for women psychologically, sexually, bone loss, and now there's good evidence to suggest there's a cardiovascular risk if you lose your uterus. And the younger you lose it, the worse the cardiovascular risk is. So it just doesn't have to be. And if you know about UFE, and you talk to patients of ours, it's transformational. It gives them their life back. Their iron and hemoglobin come back to normal. They get light periods, not these horrific heavy periods.
Right.
They feel so much better all around. I mean, and these tumors cause other issues: pain, urinary frequency, constipation, painful intercourse. It's a tremendous procedure. They need to know about it, and the information needs to get out there because it's way overdue.
Yeah. As we can see right now, and we don't know what the epidemic is, because before you came on, we have talked about that so many women just don't want to talk about it.
Right.
It's so embarrassing.
It is. It's a very embarrassing topic, but it's something that women need to talk with other women. There are 2 reasons why African American women disproportionately suffer with these benign tumors way over other racial groups.
Yeah, please help us with that one.
One is genetically it runs stronger in their family. So if 8 out of 10 African American adult women have these tumors. So you're going to know somebody in your family or friends. It's just so common. The other has to do with body fat. Nobody knows where fibroids come from, but once they arrive, they grow with estrogen. And estrogen, that's why the fibroids will often grow very rapidly during pregnancy, and why it tends not to be an issue for the most part for women once they hit menopause. So estrogen is stored in fat. And in general, if you look racially at body fat, it's the same distribution as fibroids. Number 1 is African American, and the lowest is Asian. So you can't pick your parents. You can't do anything about the genetic aspect, at least not currently. but everybody can try to be as close to their ideal body weight for their frame. No one's
Okay.
saying you got to be skinny, but everybody has an ideal weight for their frame, and
Right,
you can
okay.
lose that excess. And so that's the first thing that a lot of our patients we talk about is to get into an exercise program, try to lose that excess body fat. There are certain anti-estrogen strategies, trying to not consume as much estrogenic foods and try to eat more of the anti-estrogenic foods, like colored fruits and vegetables, for instance. They have compounds in them called flavonoids, and flavonoids block estrogen. So it's just another reason. Your mom always said, eat your vegetables. It's good for your fibroid health. It's good for your cardiovascular health. It makes sense.
Wow. So, Dr. Lipman, how did you get into this? What was your...
Well, I've been treating tumors for many years, originally treating cancerous tumors. And there was a very bright group of interventional radiologists in France that said, well, why don't we embolize fibroids? They're very vascular tumors, because we've been embolizing cancerous tumors, cancers primarily of the liver, but also of kidney, to try to make it an easier surgery. For cancer of the kidney, if you block the arteries, it makes it an easier surgery. Those tumors are very vascular.
Okay.
And so we would embolize it right before surgery, then they would have their kidney removed very easily.
Okay.
And then for the liver, it has a dual blood supply, so we could actually treat cancer because we could knock out one of the blood supplies, but the other kept the liver alive. And the tumor got its blood supply off the other blood supply. So we could deliver chemotherapy and block the arteries to liver tumors, and it would work really well. But somebody got the bright idea in France. They were like, well, why don't you embolize benign tumors? Fibroids are very vascular tumors. Dr. Malloy could attest to that.
Okay.
So why don't you do those? So they started blocking fibroid tumors prior to hysterectomy. Well, so the patient in France would undergo an embolization, this UFE procedure, and then they would go home, because in France, the healthcare system is socialized medicine. It's rationed care. And so you can't, like when I do an embolization, like they go, for the cancerous tumors years ago, they would just go right to the operating room, right then and there. But in France, when they were embolizing fibroids many years ago, they would have to wait. So they would get discharged and they would go home and they would wait for their hysterectomy. 6, 7, maybe 8 weeks waiting for their elective surgery. Well, what happened? These patients got better. Their symptoms went away.
Oh.
So the women were calling up and going, do I really need this second part? Because I feel great after the first part. And then enough women did that. They had to look at it. And the answer was, you didn't need the second part. All you needed was the UFE, this embolization. So the guys in France called the chief of gynecology at UCLA and said, you got to get your interventional radiologist on this and look at this. And that's Scott Goodwin, and he's a friend and colleague.
Okay.
And he did the first 11 cases in the United States. And then we presented papers. I presented on liver embolization. He presented his on fibroids, the first 11. I'm like, wow, I'm in Atlanta. I gotta bring this back. So
Wow.
I did
So
did it first case here, and I've been doing them ever since.
The rest is history.
And the rest is history.
Wow.
But God put me in that place, because they say I remember that very well. I called my wife and said, I know what my calling is now. I know what I've got to do.
Yeah.
And
Yeah.
so I say my practice is, I started the Atlanta Fibroid Center. We do fibroids every single day.
I like to say something to that, because I've known Dr. Lipman for a while, and a lot of my patients,
really?
yeah, a lot of my patients have gone to him and had the procedure, and it definitely has changed their life. The issue is, and he said it, is education. I have a cousin who lives in a small town in South Carolina, and she said to me, hey, my doctor here wants to do a hysterectomy. I have fibroids. She was 37 years old. And I said, well, did your doctor talk to you about, an embolization? And she says, no, it was never mentioned. So I said, so they didn't even talk to you about options? And she says, no. I said, I'll tell you what, you are in a small town. I said, there may not be, interventional radiologists there. Go to Charlotte. Go to Charlotte.
Okay.
I'm sure there's someone in Charlotte. Okay. And she did. She had the embolization. She called me. She says, thank you. It changed her life because in her
gosh.
town, there was no one there. And so instead of referring her out, they said, just take out your uterus. Okay.
Right.
And yet, by me educating her, because her cousin's a gynecologist, by me saying, hey, do this, it made a difference. And that's what Dr. Lipman is saying. That is the problem. At this conference, there was another young lady who had fibroids, and she was telling me about these different things that the doctors wanted to do. They wanted to do a HIS. I said, well, did your doctor even mention uterine fibroid embolization? She said no. So I wrote it down for her.
Right.
I said, make sure that you ask them, okay, is there someone in that area? She's small, another small town.
In a small town,
right?
huh?
I said, because there are options. Okay, just because they may not do it there should not then relegate you to have a hysterectomy when it could be done someplace else.
Why does
So,
it seem-
and so
Yeah.
what he's saying is right.
Why does it seem as though they push the hysterectomy so hard, and most doctors, the first thing they want to do is do a hysterectomy?
Right. I mean, well, they're surgeons, and surgeons go through very rigorous training, and so they're trained that their hands and cold steel will cure, everything. And it's sometimes hard for them to get beyond the fact that, you can go outside your specialty and use the, expertise of other doctors that have different skills. And, it's hard. It's hard for any physician, but I think it's particularly hard for surgeons because they train so hard and so long that, and this is their calling. You got to be, if you're a surgeon, it's a calling. I mean, it's just like, so it's difficult, but we have, lots of, gynecologists in this community, like Dr. Malloy and others, that refer us patients. They tell patients all their options,
Okay.
and that's how it should be, because,
Okay.
no one should feel, and I see this unfortunately all the time, patients saying, I never would have agreed to have a hysterectomy if I had known about this. I never would have done it. I had X, Y, and Z happen afterwards or whatever. That's a shame. Everybody should know all their options, because
Right.
the average age of hysterectomy in this country is less than 40. That's
Oh.
39. That's the average age. These are young women. As I say, I commonly see women less than 30 that have already had hysterectomy. That should never be. So women need to know all their options.
Yeah.
Yes, it's an embarrassing topic. Women got to talk to each other. I speak all over the country on this.
Okay.
In fact, you had mentioned about the men earlier. We
Yes.
love when men show up because men don't understand about this. In fact, we were on the Real Housewives of Atlanta. I was Cynthia Bailey's physician when she had UFE,
Okay.
and it almost broke up her marriage. I mean, that was the whole, because Cynthia was having issues with Peter. Now they are now divorced, but at the time they were married and were having marital issues because of the fibroids. He did not understand. She was bleeding, and so she was bleeding so heavily. When you're bleeding heavy, you don't feel like sex. Let's face
No.
it, for two reasons. One, you're anemic, and we mentioned about the
Okay,
anemia being
okay,
tired and
okay,
weak.
right.
So you're fatigued. Sex is exercise. Let's face it. So you're
Thank you, Dr. Lipman.
right. You're tired. You don't feel like that's number one. And two, when you're bleeding to the level that
Yes, 'cause
gushing
you're
and
talking-
flooding
yeah.
and say wearing Depends
It's not-
and all this gear and all this stuff, you do not feel
Feel
sexual.
like, no.
So sex goes out the window. So it was going.
That's
It
not
went
sexy.
Yeah,
That
right.
is
It
not
went out the
sexy.
window with Cynthia, and all Peter could understand from his perspective, it was like, well, she doesn't love me because we're not having relations.
Oh.
That's and there was no conversation. She loved him dearly at that time, but all he could understand was, I'm not getting mine. She must not love me.
Right.
And it's like, no. You don't understand what she's going through. You don't understand the bleeding and the weakness and tired. She was, as she said, I had an empire to build, and I'm like feeling like weak and drained. I couldn't do it.
Oh,
and so
gosh.
she's got her things trying to get her stuff going, and now she's got to feel about taking care of Peter's needs. And, right? And she's like weak and tired and anemic from these
all
darn
that-
fibroids.
Yeah. Well, that's, what, Dr. Lipman, that's what I love about this campaign. Well, now we're going to start saying mission.